crave your indulgence. So please move to the middle and move forward. If there's an empty seat before you, right in front of you, please move. Oh yeah, now we don't have to be whining and whining before we do the right thing. Please, let's do so quickly. Let's move forward. I would appreciate if this middle place is filled first. See empty seats now. I know red means danger, but I don't know, the fact that red means danger doesn't mean that you shouldn't sit on the red chairs. Please, let's move quickly, please, before I begin to call names. Please, those that are on this side, let's move here, please. I am begging us. Don't let me call names now. Let's move. Let's move quickly. Let's fill this place. Thank you. We still have some empty seats right here in front. We are in Ibadan. All right, BCC, are we ready? We want to start now with the anthems. Shall we please rise as we take the anthems this morning?
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign fatherland.
Thank you. Let's have a seat as we give ourselves a round of applause this morning as members of staff in the University of Ibadan, the first and the best. This morning we want to welcome us once again to another edition of our monthly workshop for a well-informed workforce. And today's topic is a very, 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 very important one for a lot of us. And I believe that none of us will leave here the same, because we will get something this morning. I want to first and foremost introduce the members on this side of the divide this morning. We have seated this morning our provost, Professor T.O. Ogundiran, FAS. You're welcome, sir. And we have his lieutenant seated with him this morning, the Deputy Registrar of the foremost University of Ibadan, and the Secretary to the College of Medicine, Mr. A.E. Odedele. Welcome, sir. As others join us, we will introduce them. I'm also pleased to tell us this morning that you won't be seeing only me here. I have a co-compare this morning in the person of the faculty officer of the Faculty of Dentistry, Mr. M.W. Ogumbanjo. Yeah, while I was introducing, the chairman of the College of Medicine Capacity Development Committee and the presenter of today came in. He is a cha-cha professor, you know. Let me finish now. Last month, we introduced him as Dr. O.S. Ogah. But this month, story don't change. Welcome with me. Hello. This microphone does not want me to introduce the cha-cha professor. Help me to welcome Professor O.S. Ogah. Congratulations once again, sir. And while I was speaking, the director of the Institute of Advanced Medical Research and Training walked in, Professor Ikeoluwapo Ajayi. Please, ma, your space at the high table. Can you please bring her up? Thank you very much. You're welcome once again. We also want to welcome all those that are joining us online. As time goes on, we'll also check one or two people to make sure that we know that so that they understand that we know that they are there. Thank you very much. Right now, I would like to welcome our provost for his welcome address, Professor T.O. Ogundiran.
Thank you. Good morning, distinguished members of this community. I acknowledge the presence of all the principal officers of the college who are here, and all the members who are here both in person and online. I welcome the Deputy Registrar and the Secretary of the College, the Director of AMRAT, and our distinguished speaker for today, Professor O.S. Ogah. So this morning we are going to be listening to a professorial talk from him. I welcome all the members of the college community who are online. There's no doubt that this event, which takes place every month, has become one that everybody looks forward to. And it shows the importance of it, and especially the choice of topics that have been featured in the times past. So I encourage us to keep coming, hoping that we'll continue to be entertained as much as possible. Today, we're looking at a very important issue: beat sudden death. Live free from heart, brain, lung attack. There are only two things I will need to bring out from this topic. The speaker, I'm sure, will do justice to it. The first is that there's really no sudden death. That person just died suddenly. Maybe unless road traffic accident happens, or the person ruptures some blood vessels inside him, in the brain or in the tummy, and then he or she bleeds to death suddenly. But usually there is something that heralds the so-called sudden death, but which the person has not paid attention to. So aside from sudden events like road traffic accidents, God forbid, or sudden rupture of a blood vessel, or something like that, or somebody is shot, nobody actually dies suddenly. But not many people pay attention to all those small warnings. Somebody has headache, takes paracetamol, comes again, takes paracetamol. That headache is already a warning. But because paracetamol is available, headache is common, it is ignored. So therefore, I believe that this topic is very important. The second thing is that I'm sure all of us have heard about heart attack. But now we are talking about brain attack, lung attack, and so on and so forth. But let's leave the main gist to our lecturer. And I'm sure that at the end of today's event, we would all have been educated. But don't just be educated. Let it impact our lives positively. I'm sure we're all going to have some adjustments to make to our lifestyle so that we can beat sudden death. I pray that God will grant all of us good health and long life. Good morning and welcome. Please let me apologize upfront that I will leave the event earlier than the end of the program.
Thank you very much, sir. Please, let's give our provost a round of applause.
Thank you very much, our provost, for that welcome address. We have come to the next stage of the program where we will invite the Information Technology Unit, ITU, for their nugget. Please come up.
Good morning, sir. My voice is not loud. Good morning, sir. Good morning, Provost, sir. And good morning to the management staff of the College of Medicine for this opportunity given to us at the ITU for our short presentation. This morning, I'll be making a short presentation
on how to fix messy data on Microsoft Excel. I'm quite sure many of us are quite used to using Microsoft Excel in our offices. So I will be discussing on. Is not speaking up? Yes. So this morning I will be talking on. Okay, so what is data cleaning? Data cleaning is the process of fixing or removing errors in the worksheet of the data so that the data will be accurate, consistent, and ready to use. And when we talk about data cleaning, this involves removing blanks, correcting formats, fixing spellings, and at the same time removing duplicates in the Excel data that we have with us. And why is data cleaning important? If you may ask, data cleaning is important because it keeps information clear, correct, and easy for everyone to use. And it improves professionalism in the sense that clean data looks neat and well organized when shared with others. It saves time. You don't have to waste time fixing errors. For instance, now, if I'm to receive the data to be it from the finance unit or from the HR unit, in as much data has been properly cleaned, I won't spend more time trying to adjust or try to fix some of the errors in the data. And at the same time, it prevents confusion in the sense that if I'm to be given a data regarding those who are gathered here, and we have to make some analysis on it, trying to find out the number of male that were present here. With a well-formatted data, I would have a precise figure to make my analysis on, stating that probably we have 50 male present and 70 male present. So those data which we have with us, if it is well prepared, it will make us being able to give such analysis. And at the same time, it improves data entry accuracy. At the same time, it makes collaboration easier and it protects credibility. If I know that data I will be collecting from finance is well to do, I wouldn't have any issue proceeding with making use of such data. And what are the common problems that we have with data? One of the common issues is missing values. There are some data that come probably maybe where they're supposed to be named. You might find no name present there. We might have duplicate entries in the sense that we may have multiple records showing at the same time. We may have extra spaces, invalid formats. To be it when we are to enter an email address, some of the email addresses may not even have a hat, or on a normal day, a normal email address you have maybe a name at so-so-so.com. So an invalid email address might actually make such data which you are providing redundant. At the same time, inconsistent text. We may have some text whereby when I'm to provide my gender, instead of me writing male, some people may write M to signify male, some people may write male in capital letters, and some people may write the male in small letters. So with data cleaning, you would ensure that every information you'll be entering into the data is consistent. If I will be entering male, the male will be capital letter all true, and if I will be entering it in maybe in small cases, it will be small cases all true. So, and what are the tools for cleaning in Excel? We have some functions. Assuming we can project, I would have shown some of those things. So we have the trim function, we have the proper function, find and replace, remove duplicates, and text to column function. And at the same time, formatting data in Excel, we can format data to make it readable in the sense that the fields that would occupy some certain data, we will format it in such a way that they are actually, okay. Okay, thank you. Okay. So I prepared a sample data for us to see what, when I'm talking about data, you can relate with what I'm talking about. So this is a sample data in Excel, which I prepared. So we can see from this data, we have a column for the staff number, and we can see from here we have different inconsistent formatting for the staff number. There are some staff number that has a slash in between, and there are some that doesn't even have, there are some that has an hyphen. So one of the work which a data person will do, someone that will be working with this data, is to ensure that the staff number format column is well formatted, in the sense that every information there should look unique. It should be uniform. In the sense that if I'm to use the slash, I should ensure that every other staff number which I'll be having there will all have a slash. And at the same time, you look at this gender section, we have some gender written as M to signify male. We have some written as female. If I'm to do an analysis on this type of data, I will get a wrong result, because the male that is written in small letter M, that is written in hem, and the one that is written as a whole, as male, it sees it as a different record entirely. So, and we have some of the dates here as well. You can see the dates formed. We have some dates written in a particular format, and we have some that are written in a different format. So we ensure that the dates are well prepped at the same time. Because of the time, I won't be able to show how to clean the data here. So here's the final tip. We should always ensure to keep the original data we are working on. Before you start working on any data, you should ensure that you already have a copy of that data. In case anything goes wrong, you can easily revert back to it. And at the same time, you should always ensure that whenever you are making use of formulas in your data sheet, you should be very careful. And you should at the same time double check on the data you are making use of before you can make some analysis on it. So thank you.
I'm sure that we have all learned one or two things concerning data cleaning. So anytime you are entering your records, I'm sure with what we have learned today, we'll be able to enter our data very correctly and accurately. Now we are going to the business of the day. And the provost laid a very good foundation. He told us that sudden death really is not, there is really something called sudden death. I've learned a long time ago that we call something death by installment. Most of the problems we have around us today are in installments. So somebody dies, it's not sudden. There has been a build-up. And that's why today we are looking at that, at the topic, beat sudden death. So we are not to fear death here, we are to defeat it. That's why we are here at this workshop. So we beat sudden death, we should be free from heart, brain, and lung attack. So the topic of today is beat sudden death. Live free from heart, brain, lung attack. So today we are going to learn a lot. He's working. So as I said earlier, your greatest wealth is not in your bank account. Yeah, it's a balance. Your greatest wealth is not in your bank account, but it is in your heartbeat. So what we are learning today from Professor Ogah, before he comes up, I want to read his citation. I want to go through his biography. Sir, please can you rise up, sir. Professor O.S. Ogah, Professor Okechukwu Samuel Ogah is being celebrated for 3 things today. Number one, my colleague had mentioned that his professorship was announced just about 3 days ago. Please, a round of applause for him. Last month, he was Dr. Ogah. Now, he is Professor Ogah. Congratulations, sir. Okay, sir. Okay, sir. Okay, sir. Now, he's also the chairman of the College of Medicine Capacity Development Committee. Another round of applause for him. And today is our presenter. Professor Ogah obtained his basic medical degree from the University of Ibadan in 1995. He returned to the Department of Medicine, University College Hospital, Ibadan in 1998 for his postgraduate residency training and completed in 2004, in addition with 1-year clinical fellowships, each at the Department of Cardiology. In September 2009, he returned to the Cardiology Unit, Department of Medicine, after he had gone to the Heart Center in Leipzig in Germany at the Department of Cardiology and King's College Hospital, London. And he joined the services of the Federal Medical Center, Abeokuta, in 2004. In September 2009, he returned to the University College Hospital and rose to the rank of hospital consultant. He joined the University of Ibadan in 2019 as senior lecturer and honorary consultant cardiologist to UCH. He was promoted to Professor of Medicine on Tuesday, 18th February 2026, with effect from October 2024. So his promotion was backdated to 2024. Professor Ogah is a Bernard Land visiting scholar at the T.H. Chan Harvard School of Public Health, Boston, USA, and an affiliate member of the Hatta Institute of Cardiovascular Research in Africa at the University of Cape Town, South Africa. He is the immediate past president of the Nigerian Cardiac Society. Please, a round of applause for him. And he currently chairs the scientific committee of that society. One thing that will amuse you and amaze you today is that our lecturer of today, as at 2015, in 2010 precisely, he got his leave of absence and he became the Honorable Commissioner of Health for Abia State in Nigeria. So we are talking about somebody who has tasted the town and is in the gown. So please welcome with him Professor Okechukwu Samuel Ogah for his presentation. Thank you very much, sir.
Provost, the Secretary to the College, the Director of IMRAT and Dean of Dentistry. Ladies and gentlemen, thank you very much for giving me the opportunity to speak on the topic, Beat Sudden Death, Live Free from Heart, Brain, and Lung Attack. I'm sure, as the Provost has said, we are all used to heart attack. And today we are hearing of brain attack. And we're also hearing of lung attack. There are three vital organs in the body, and very, very vital. Without the heart, the body cannot receive nutrients. Without the brain, you cannot even coordinate what we are doing here today. Without the lung, you cannot breathe the free oxygen that God has given unto us. So, but these three organs can suffer attack. And when they suffer attack and care is not available, an individual can die suddenly. Now, if you look at what I have shown there, you can see that our newspapers are always, riddled with cases of cardiac arrest in Nigeria. It's not a peculiar thing in our country. It happens all over the world, as I'm going to show. So people are worried. How do we deal with sudden death, even in the country? Even as at yesterday, somebody who has been, thinking of what to do in when is the next election? Just died. So that is sudden death. He never knew that death was coming, but it came. So I have listed a lot of scenarios where things like this, it can happen to special advisors. A former president of Institute of Chartered Accountant of Nigeria. These are newspaper reports. A senator, a judge in the court slumped and died. A lawmaker in one of the states also slumped and died. Not even old people. You may think that it's only for old people. Younger people also slump and die. A copper, or people who are being recruited. They just want to have their job, maybe in the military, on road safety and all. Most often they will ask them to start running in the street. And we see a lot of people dying on the street. Governors, wife of a pastor, things like that. These are the things that we hear every day on our newspapers. Sometimes the touching ones is when you see people playing football on the pitch and they slump and die, and which is very common. In Nigeria, we remember what happened some years ago, and a crucial match in Lagos, and a dear player of Nigeria, he just slumped and died. Just about 2 years ago, that was the Nations Cup, the crucial match between Nigeria and South Africa. It was a very tense match. So many, not less than 4 Nigerians died just by watching football. They didn't die because it was a bad match, but because they had a health, just like the provost said. There was something in them which was not taken care of, and that led to sudden death. So you can see some scenarios. Somebody slept and did not wake up. I'm sure you have heard of that before. Or somebody slumped in the market. Or somebody slumped at home. Or somebody went unconscious but died before he got to UCH. Or somebody slumped at a meeting and died. Or somebody giving a lecture and slumped and died. Like I said, during Nigerian games or during employment, people are made to exercise. Even the common one we see today, Because a lot of our people have traveled abroad, and as soon as they leave this country, Nigeria becomes a zoo to them. They don't want to come back. They want to take their parents, call their parents to come and visit them. When these parents travel to Canada for 12 hours, they collect cloth in their legs. Some, as they are coming down from the plane, they'll slump and die, or even when returning. So we see a lot of cases, people having lung attack. The clot in the leg now migrates to the lung and just obstructs the airway, and the person will die. So what do we mean by sudden death? Is death due to cardiac causes occurring within 1 hour of onset of symptom. That somebody is in the market and suddenly slumped, before you get the person to usage, is gone. Unexplained sudden death occurring in an individual older than 1 year of age, we call it sudden unexplained natural death syndrome. We also know that there is unnatural death, which even is the common cause of death in Nigeria. Death from accident, death from fall. Somebody has climbed palm tree to cut palm nut and then falls from there and dies. So it's different from what we are talking about today. Or somebody going to Lagos and has an accident. It's a different thing. So the information we have is that in the US, for example, about 0.1% of their population will experience a medical emergency or out of hospital cardiac death. That same data we have in Europe. It's a similar thing. And most often in those environments where they have good data, most people who die are usually between the ages of 66 and the mean age of 66 and 68. It's more likely for men to have sudden death than women. We must go home with that. And if you look at this chart I've shown here, this is from America. You can see that sudden death is more common in white men, followed by non-white men, meaning black, Indians. And then you have, it's commoner in non-white women compared to white women. Now, if you look at the whole population, commoners in white men, followed by non-white men, and then non-white women and white women, meaning that probably the white women take good care of themselves. They're more likely to seek for help, they're more likely to go to the hospital, or more likely to take their medications when they have a diagnosis. Now, I'm showing another here. What we've shown here is that this is a data from America, and it's not different from what we have. But the only thing is that if you look at people who are older than 35 years, and then you have people who are younger than 35 years, the cost of sudden death is different. If you look at those younger population, it is a genetic problem when you have the heart become so thick that they're likely going to have, the heart running so fast, and they will die in the process. This we also see in our hospital here in Ibadan. If we screen about 100 of us, you may have one person who may have this kind of problem. So these are other common problems, rarer causes of sudden death. But the commonest that people screen for is what we call hypertrophic cardiomyopathy. I will show us a picture of that. But now if you go to people who are older than 35, abroad is coronary artery disease. In our own environment, it will be stroke or heart failure or other things related to high blood pressure. So these are other causes of that. You can also see even in that population, hypertrophic cardiomyopathy, but a small percentage. So if you see a young person coming with sudden collapse, the you have to look at different causes in them. Now, let's look at the first one, which is the heart attack. What happens in heart attack? God has given us, this is our heart. There are small, small pipes that feed the heart. As the heart is feeding other organs of the body, it also has to feed itself. But these small pipes, I have enlarged it here, may have some fats trying to block the pipe. When this pipe, this cholesterol here breaks, the blood flow to the heart becomes closed. And then you see somebody holding his chest because the heart is not getting food again. And the individual can slump and die. That is heart attack. So, meaning that if we are engaged in things that will increase the cholesterol in our body, excess fat, excess milk, excess oil, or even excess body build, we are not doing exercise, this fat can build up in our arteries and can rupture one day, and then an individual will have heart attack. Now, I told us before that for young people, it is not their making, it's the way they were born. So during the process of the heart development, there were some changes that will make the wall of the heart to be so thick. If it becomes thick, it cannot accumulate, enough blood here. So the person can, even if he does exercise, he cannot have enough blood that goes to the brain and other parts of it. He can collapse and die. And the heart can also run so fast, suddenly, and it can die. And if you have such a people who are footballers, they may not know they have a heart disease, and then they start going to run or even doing ordinary race, they can die suddenly in the field. And that is why today, before you go and play in those, even in Nigeria, they must do a critical workup on the heart to make sure that your heart is in order before you can perform such sports. Usually by the time they come to us, maybe we just do a simple ECG. You can see the spikes are so high that even the machine is struggling to record the ECG. It gives us a clue that something is wrong with this heart. So it's not an Oyibo problem alone. It also happens in our own climate. Recently I heard that one of my classmates, who was even here before, by the time he got abroad, he was having palpitation. And they went to do an echo, and they found out that he had hypertrophic cardiomyopathy, and he's on treatment. And then now remember that his father died earlier because it tends to run in families. So if you have sudden death, or somebody slept and didn't wake up, the family need to be screened because there may be a problem in that family. It's not that somebody has sent something to them. It is something that can be taken care of. You understand what I'm saying? It's not every death that is a jazz. I mean, that's what we call it. So we need to screen. And usually, when we see such a thing in UCH, we try to invite every member of the family to be screened. Recently, we had one and invited everyone. 2 out of the 5 children have the same problem. So now we have left the heart area. Let's look at the brain. This is the major problem we have in Nigeria today. Stroke is the commonest cause of death in UCH, in Ibadan, in Nigeria. If you go to the emergency room, almost every day we have 3 to 5 cases of stroke. And out of that 5, maybe 2 of them may not make it even up to the ward. So what happens here? We have basically go home with two types. Here, the same thing that happened in the heart. You see that there's a cholesterol there. These are pipe, the heart is down here. These are the pipe that take blood from the heart to the brain. I have expanded it. This is where the problem is happening. I've expanded it. There is a cholesterol plaque there. And if it suddenly blocks the pipe supplying the brain, that part of the brain becomes dead. We call it ischemic stroke because it blocks blood supply to the brain, and then that place becomes dead. The other type is that, for example, somebody who has high blood pressure. The pressure is so high, you know what happens in those days when we have water supply from the town. If the pressure from the water works is so high, the pipes will blow. Is that right? The same thing happens here. If the pressure in the body is so high, it can break the pipe and it will burst in the brain. And you know our brain is covered with the skull, it doesn't expand, and once such a thing happens, the pressure in the brain becomes so high, the person will just collapse, may even die immediately. So you can see here that you can have what we call hemorrhagic stroke, or you have the ischemic stroke. So, but this has warning signs, which is good. Number one, we call it fast. Usually, the thing is that when it's coming, the face will tell you some signs. The face may drop. Or there becomes sudden arm weakness. We don't have partial stroke, because that's what we hear. Stroke is stroke. There's not stroke that is partial. Do you understand what I'm saying? There is nothing called what? Partial stroke. Stroke is stroke. It's that stroke that, because naturally the way God has made us, my right hand, my right brain will control my left. Do you understand what I'm saying? My right brain will control the left side of my body. So if there is a blockage in the pipe supplying the right side of the brain, the weakness will be on where? On the left. So it's not partial, it's that there is a stroke on the right side. So there will also be speech problem. That's why somebody who has had stroke, he may find out that one face of the face is dropped, he cannot lift the hand, and then the speech becomes abnormal. Somebody who used to be, a teacher before, how will he teach again? He can't teach. Or a singer, he cannot sing again, because once it's happened, that's a problem. So, but today we know that, advancement is going on because everybody's worried. If you catch this kind of stroke, this one that has a blockage here, and gets to the hospital on time, there are drugs we can give. There are drugs we can give. There are drugs we can give to break this, and the person's weakness will resolve immediately. But if somebody comes 2 days after, 3 days after, there's nothing we can do. The same thing goes with the heart. We encourage people, you have chest pain, you must arrive at the hospital immediately. If you have traveled abroad, you can't sleep, because sometimes you'll be hearing a lot of ambulance moving here and there. That is the way the system has been made. You have sudden chest pain, you call the emergency team. They pick the person to the hospital. They have even been trained to the extent that once they do ECG on the person and shows that the person has had a heart attack, they give the injection. And the thing will resolve immediately and save the life of the individual. Now, this is also a problem. You can see this is the way God created the pipe. From the heart, a pipe goes to the brain, another one goes down to supply all the organs in the abdomen. Now, if the pressure is so high in the body, Look at this. So clean. Can we see something here? It has become what? Balloon. It can actually rupture. And somebody will collapse and die. This week, as I'm talking to you, we had a case in UCH here. A young man, maybe 44 years. He's been running BP. He didn't take his drugs. By the time he came, severe chest pain, severe back pain. We told them, this person has had aortic dissection. And by the time we did all our tests, we confirmed what we suspected. So it's not only an Ogbo man's problem, it's with us. So the also good thing is that there are procedures either by intervention, cardiology, or by cardiothoracic surgeons to solve problems like this. But this can be prevented because if you can, so somebody to get this repair in Nigeria now costs over 10 million naira. Now, for one reason or the other, this is a normal heart. This is a normal heart. You can see the thickness of the wall. But for one reason or the other, either by genetic problem or infections, viral infections, or some abnormalities during pregnancy, or excessive alcohol, or other things, this heart muscle will lose the strength and becomes weak like this. Something that's supposed to pump, maybe at 70%, now pumping at 20%. The person will automatically go into heart failure. And if it's not properly managed, it can die suddenly. Now, the other thing that can cause sudden death, if you have abnormal rhythm of the heart, the way the heart beats boom, boom, boom. But if you get a heart that is running beyond 150, the heart should run between 60 to 100. And then you have somebody's heart running at 300. It cannot sustain, life cannot be sustained there that way. The person can collapse and needs to be rushed to the hospital. And this is the kind of thing we see when we do ECG in UCH. And that person, if you don't shock that person to bring that reading back to normal, within 30 minutes, the person is gone. Now, I told us before, this is what we call the lung attack. This is our lung, this is the heart. The heart supplies blood to the lungs, and the lung supplies air to the blood. So, if you have a blockage in the pipe supplying, returning blood to the lungs, or if you have a clot that blocks the pipes that receives oxygen from the lung, the individual will not have oxygen. The person will die. And what are the risk factors? Now, when we are excessively big, if you have hypertension or diabetes, if you have a medical condition that we are not treating, somebody who is sitting in one place for a long time, not moving around. The last time we said that, I think we discussed that people should move around in the offices. Yes, so clots, the veins here can become weak. And the blood, maybe if you have seen animals, when they kill animals, immediately you kill, the blood is soft, is that correct? But after some minutes, it does what? Thickens. So that's what happens. So in the leg, the clot can form here, and it can migrate through the right side of the heart and go to the lungs. That's what we call pulmonary embolism. It's also common in hospital patients who are on admission for a long time. People who have fractures because they cannot move around. But thank God we have some drugs we give so that the person will not be at risk of forming clots in the body. Pregnant women as well, because there are things that happen in the blood within during pregnancy that puts pregnant women at risk. So they need to move regularly. Now, this is the end of all of them. When you start seeing somebody like this in the hospital, the heart has failed, is at risk of death. People like this, if they are in heart failure, the heart has gotten to the stage where it's irreversible, 50% of them will die in 5 years. And then they need medication all their life in order to remain alive. Now, so what I want to show us is that we have some information about sudden death in Nigeria. And this was a collaboration of different hospitals in Nigeria, including NIMA, even the police. They were all interested why people die. You can see this logo belongs to us. So UCH participated there. So what is the profile of sudden death in Nigeria? You can see here that, as I said earlier, even as abroad, men die more suddenly than women. Well, those who are married more likely than single people. Doesn't mean it's just because of the age factor. You can't, sorry. Not because you are married, but because of the age factor. Now, look at the age where it is common in Nigeria, 40 to 60 years. But then you can see, as I said earlier, young people also die suddenly from non-traumatic causes, such as hypertrophic cardiomyopathy or dilated cardiomyopathy. Now, even whether you're educated or not, you're still at risk. What is the occupational distribution? Businessmen, most common. Because they sit down in one place from morning to night. You look at civil servants, so that's where we belong. We are the taking the silver medal, is that correct? Unemployed people, students, security men, clergy, coppers, farmers, including what? So it doesn't spare anybody. Now, if you look at the distribution of causes of sudden death, it's all that we have been talking about. Look at the three champions here. Myocardial infarction, heart failure. This is the same thing as our stroke. Pulmonary embolism I mentioned earlier. That's why I brought those three key things. Heart attack, brain attack, and what? Lung attack. Those are the common problems we have that cause sudden death in our environment. Now, what are the risk factors? One, blood pressure. We didn't talk about asthma. Just recently, a good friend of mine, a childhood friend, a lecturer, maybe it's even a professor, he's living alone. The family is in Lagos. He had an attack, asthmatic attack, nobody at home to help. He died in his toilet. So these are common causes of the risk factors. Now, the reason why we are here is that the knowledge of causes of heart attack, brain attack, and lung attack is quite deficient. So the study, they looked at what the knowledge is. While I define to you what sudden death is, you can see the number of people who got it right. Meaning that our knowledge is what? All about it. When somebody dies, they'll say somebody in the village has sent an arrow to him. But the BP is 200 over 130. So let's go home today that we need to take care of ourselves before we even look for other things that somebody has done. So our knowledge of sudden death is very poor. What is our perception? Perception is also poor. You can see here that They believe sudden death is a public health priority in Nigeria, only 12% or 13%. Willing to investigate sudden death for suspected cases, only 13.7. Sometimes we actually, in Africa, we are the one causing problem for ourselves. Most of the data we have in usage, we still quote the 1960, 1970s data, because at that time, every death was investigated. But today, the autopsy rate in usage is less than 5%. Every sudden death is supposed to be investigated, because somebody who died from hypertrophic cardiomyopathy, how will you know that we need to screen family members who would have buried the knowledge, who would have buried the help, who would have afforded to the family members? But it's unfortunate that even in usage now, somebody dies suddenly, to investigate it, it is even the health workers that will be fighting it. Do you understand what I'm saying? But abroad, every death must be investigated to know the cause, so that it can help those who are alive. But here, we are causing problem. The white men did all those things, set up the system that was working, but we have destroyed everything. Now, how do you investigate sudden death? Like I was saying, only about 21% believe that patients should have an autopsy done. But I think so many other things make us not to investigate sudden death. Sorry. Oh. All right, sorry. So the evidences we have, we can see that cardiovascular causes, from the little knowledge we have from Nigerian hospitals, this is from Ife, where they have really done some work on sudden natural death in Nigeria. You can see that most of the problems, you can see these are the common cardiac causes. Hypertension, as I've said, coronary artery disease, dilated hypertrophy, all these things are some of the issues that we had discussed earlier. Respiratory causes, asthma, pneumonia, especially in children, brain hemorrhage, even cancer-related causes. Now, here you see that hypertension and sudden unexpected death. This is a big problem. This is from Lagos, showing that high blood pressure is the greatest killer in Nigeria. Most of the people who come in, rushed into the hospital, who have even died at home before getting to the hospital, is related to hypertension. So you can see here, heart disease, stroke, myocardial infarction, heart failure. They're all part of all that we have just discussed. The same thing in Lutz is the same problem. You can see also heart failure. Sorry. I have brought up this to show that we have evidence, to show us what are the killers of our people in Nigeria. So even in Lutz, we have similar thing. You can see, look at that. They are all the same thing, stroke and heart failure. This is from far away in Maiduguri. They also have similar problem. You can see here that even in the north, the rate of coronary artery disease is even higher compared to what we have down south. So what do we do? How do we screen? As I said earlier, apologies, we had planned to station some blood pressure machines. As you come in this morning, you check your BP so that you know your blood pressure before going home. And I still encourage you, I'm sure my people are outside there, please check your BP before you go home. Now, screening. The single most common cause of sudden death in Nigeria is related to blood pressure and probably blood sugar. If If we can address those two issues, we would have addressed a lot. Meaning that we must screen ourselves, screen members of our family, especially people who are above the age of 40, must do screening. Blood pressure screening, and if you're hypertensive, take your drugs. If you're diabetic, take your drugs. Before science moved to the stage where we are, people were dying like animals. I have read a story of an American president, because at that time there was not a good blood pressure drug. A sitting American president died because of uncontrolled blood pressure. So need for screening, and if there is a sudden death in the family, which is not that somebody was traveling to Lagos and had an accident, but somebody slept and didn't wake up, there's need for such death to be investigated, because it will help those who are alive so that they can amend their ways, take their medications, and if they need extra treatment, they can also be given. Most of these things have, devices to prevent sudden death, especially those who have genetic problem. There are devices we put in the heart such that when the heart is running fast, you can just block it. So there's need for screening. So then family history is important. We always try to find out what the family is like, if there is history of sudden death, and if somebody has an abnormality, this should be properly examined and investigated, and appropriate treatment given. These are things we do in our own unit in order to investigate individuals who have family history of sudden death. So these are not for us, but I think the out of hospital prognosis of sudden cardiac death is around 7%. That is in the best of centers. The out of hospital survivor, not death. So the opposite of mortality there will be what? 90 what? 93. So even in the best of places, because they don't get to the hospital earlier. So the earlier, the best is prevention, and prevention. Thank you very much.
Please, let's give our presenter a standing ovation, please. A standing ovation. Thank you so much, sir, for that lovely presentation. You can go to your seat while we'll... Thank you very much. Please, let's have our seat. Please, there will be a slight change in the program. The provost has to leave now. So we'll invite him to give his closing remarks while the program continues. Please, let's invite our provost.
I'm a man under authority, so they've said I must give a closing remark while the program still continues. I don't understand that logic, but since I'm the servant of all, I have to obey. Well, the comment I have to make is to appeal to all of us. If we check the blood pressure of all of us here now, oh, you know the answer already. Now, some people will say they don't want to know. You see, the essence of having medical whatever around is that so that we can prevent these things. That somebody is hypertensive is not a sin, is it? And that somebody is hypertensive or diabetic doesn't mean that you are the most useless person on earth. Not at all. You see many people jumping here and there, active, and they are doing their work. They have one problem or the other they are managing. But because they are paying attention to their health, they pay attention to their blood pressure, they pay attention to their cholesterol, they pay attention to their diet and all that. And there's nobody who is 90-year-old today, or 80 years, or 70, even 60, that doesn't have something. So don't think that when you see some people, they are 80, they are 90, they are 100, it's not as if there's nothing wrong with them. Why is my own like this? No, it's because they are taking care of themselves. When they are sick, they go to the hospital, they take care of what they eat. So because somebody has diabetes, hypertension, or whatever, does not mean that that person cannot live the whole length of his life that God has given him. So please, let's remove that fear, all right? And let's take care of ourselves. I think this is the message we should take home. Thank you.
Thank you very much, sir. Please, let's give a round of applause as he leaves. Thank you, thank you, thank you, thank you. Maybe I should become a small girl again, so Provost will come and he will shake me before he leaves too. Thank you so much once again, sir. We really appreciate that presentation. I want to believe that our questions are ready. We have some with me. And please, those online, we will please crave your indulgence to throw your questions so that we could answer them while here. While the presentation was ongoing, some other people on this side of the divide joined us. So before we answer some of our questions, I just want to, appreciate their coming. First and foremost, I appreciate the presence of the Baba Olowo of college. Even his dressing is Baba Olowo dressing. The financial controller, Mr. Eso Ayanshina, you're welcome this morning. And of course, beside him, the medical librarian. If you don't read, you are dead. In person of Dr. Grace Ajuwon. You're welcome, sir, ma'am. And of course, on this side, we have the Dean of the Faculty of Dentistry, Professor B. Kolude. You're welcome, sir. Our Mama Dean is even I didn't even look at this place. Please, this morning I want to, with Towo, introduce our Mama Dean and also invite her to, Mama Dean said she doesn't want to come. But please, a round of applause for the Dean of the Faculty of Basic Medical Sciences, Professor Oyerunke Odunola. You're welcome, ma. Thank you so much for coming. And here we also have a representative of the Chief Medical Director of the University College Hospital here this morning, Dr. Oluwashola. Thank you, sir, for coming. We appreciate your presence. We also want to appreciate the presence of people that joined us online. So many people, a lot of academic staff, a lot of non-teaching staff online. We have, in fact, our normal, or should I say, constant companion online. Mr. Isama Kinde, I think, is online. And then we also have the registrar of the Precious Cornerstone University, Mrs. Morenika Folabi. We appreciate your joining us online. We also have one of our heads of department, Professor Folake Lawal, online, the head of Department of Periodontology and Community Dentistry. And every other person, we appreciate you. So right now we go to the question and answer, comments and all. I think the ones I have with me, sir, I will give you to read them. If we have any other one, please let's bring them forward.
Thank you very much, ma'am. While talking, sir, you mentioned high blood pressure as one of the risks for sudden death. What about people with low blood pressure? Okay. The second one is, thank you for your brilliant delivery. I attended a training where we were told that moderately taking wine that is good for the heart. How true is this statement? Thank you. My blood pressure hovers around 140/92 to 143/85. I am 62 and I've been on medication. What is the normal BP for my age in Nigeria? Okay, let's start from the last one. One is that clearly you told us you're hypertensive. And your BP still hovering within the hypertensive range, meaning that your blood pressure is not well controlled. The normal BP should be below 130/80. Anything above that, your blood pressure is still not controlled. So you may need to see your doctor. They may need to adjust your medications so that your BP can be properly controlled. It's good that you have been taking medications, but the medication is still not optimal. Thank you very much. Those from cardiology unit, please set up a table at the back of the hall where they are doing registration so that as soon as we end the meeting, people can take their blood pressures. Thank you very much. Now, I attended a meeting, a training where we were told that moderately taking wine, that is good for the heart. Well, you know, science keeps changing. Moderate alcohol was what was prescribed, was advised in the past, but the recent documentation by the WHO says no amount of alcohol is safe. That is the way I will put it. And if we want to obey the science from WHO, but that is where we are now, no amount, because the tiny one is what will lead to excess one, so you don't know the limit. So the WHO prescription is that no amount of alcohol is what? Safe. Why this individual said low blood pressure, but I don't accept I have what you mean by low blood pressure. If you have a blood pressure of 90/60, that is still good. If you have a blood pressure of 100/60, it's still good. So you need to give us value to know whether you are truly low or what is normal to you. There are families that run relatively low pressures, which is good for them. And they run, they do every other thing, it doesn't, but what's any blood pressure that makes you to feel symptoms of dizziness, and then you know that it's not good. There are families that run 100/60, 110/60, and that is good for them. Thank you. Now, hepatitis, can it be? Hepatitis B, how can it be taken care of? Well, this is not the topic of today, but I think if somebody has, if you have done screening and it's positive, you need to see us so that we will send you to the appropriate place so that you can be taken care of. But I think it's maybe it's something that we need to discuss in one of our meetings, bringing the hepatitis people to talk to us. But if your hepatitis status is positive, please see us so that we can sort the person out. People with low blood pressure are at risk of what medical condition? Like I've told you, we need to know what you mean by low blood pressure. Your low blood pressure may be normal to me. Do you understand what I'm saying? If you have a blood pressure that doesn't give you symptoms, if you have 90/60, 100/60, you are fine. The only problem is that such individual, if they have an accident such that they are losing blood, they may be more at risk than those who have relatively higher blood pressure. But if you don't have any problem, that is good. Now, what is the implication of strange occurrence in the heart when one feels a kind of shock and stops under 1 minute? Well, it may be that the heart is beating abnormally. If one has such a thing, we need to see also that we can investigate what is causing the abnormal heartbeat. Yes, it may be a heart symptom. It may be palpitation that you are having, or maybe the beat is escaping. So we need to investigate that to know what is really causing the shock in the heart. Please, does migraine have anything to do with heart attack or brain rupture? If possible, what can be done? Migraine is a different disease entirely. It's not related to heart attack or brain attack. It's a different disease entity, and should be taken care of as migraine and not brain attack or heart attack. Thank you. Yeah, why do women suddenly suffer from palpitation during menopause? How can it be managed? Thank you. Yes, there are a lot of non-specific symptoms that occur at menopause. Some may be because of the hormone withdrawal on its own. Some may be because the hormone has been withdrawn, you are now like a man. The things that men have been suffering 10 years earlier, you have started having them. Your blood pressure is going up and all those things. So you need to see the doctor so that we can separate a heart disease from menopausal symptoms. Yes, palpitation can occur in menopause. Like I told you, before menopause, God has endowed women with so many things that protects them. But once that hormone is withdrawn, you start suffering what men had been suffering earlier. Palpitation, blood pressure will be there. If there are occult heart disease that has not been, it will start manifesting. So see your doctor so that we can separate the two. As an expert in cardiology, what do you think should be done to mandate or enforce death investigation in Nigeria so as to provide enough data causes of death in Nigeria? What do you think are the causes of people's resistance to investigating the death of their loved ones? And what are the solutions? Thank you very much. I think we need a legal framework for it and an institutional policy. Like I said earlier, if you look at data we have, when the white men were here, I mean, somebody will not come from Ogah and tell the white men that they were obeying the rule that the sudden death must be investigated. Although we still do that if you have corona cases. It still happens by the hospital policy. But because somebody dies, you need the consent of the family and every other person before you touch the body. That is what is necessary. But what are the problems? Number one is our traditional beliefs. One, that if you caught the person when he comes in another life, he will be caught. But I don't know whether that is true. The second one is issue of religion, which most of us know, that somebody dies, must be buried within so and so time. Those are the things that hinder investigation. But even in advanced world, even in the Arab countries, they have data. sudden death is not taken for granted. But I think it needs a legal framework. There was a time the Lagos State made it mandatory for all deaths, sudden deaths, to be investigated, and it was working, but I don't know whether that is still going on. But it's something that needs to be, but you will go, if you present such a thing even to the policymakers, they themselves, such beliefs are in them. So it becomes a problem. But I think something that needs to be sorted out in Nigeria, because we are losing a lot of information, things happen. And when a sudden death occurs and is properly investigated, if you have somebody you had, the man or woman had quarrel with in the last 1 year, it's a problem. Family members will now suffer because they say that's the one who killed somebody who they didn't kill. So it's a big issue. Kindly give the full meaning of warning sign of stroke given in the past. Now, I said the first thing is that the face will drop because one side of the mouth, will be dragging. The stronger side will drag the one that is weak. So the person will not be able to speak well. Somebody who has been speaking properly before, the speech becomes distorted. And then I said that, the limb will become weak. And then we need to act fast. So that is what it means. But unlike many other conditions in medicine, stroke is what is easy to recognize. You have somebody who has, most often it's stroke until proven otherwise. So it's easy to know that somebody, if I'm going to Ibadan now, I'm asking who has had stroke in this family. It's easy for them to say yes, unlike saying somebody has had a heart attack or which wasn't properly investigated. I think those are the ones I have.
Then the one online.
Is it possible to have stroke as a result of having too much sex? Well, if the individual has a risk factor, I would say if that individual has a risk factor, uncontrolled blood pressure, or other heart problems may become a problem, because we have had cases of stroke that happened, they brought from the hotel, because, somebody bled in the brain. Most often it's bleeding into the brain. It's a common, well-reported condition. Yeah, I would say that if the person's blood pressure or heart condition is not properly taken care of, that's the way I will answer that. Yeah, in a situation where a person is hypertensive and drug is causing another problem, what can such a person do? Thank you very much. Yes, you are right. A lot of the blood pressure drugs have their side effect, but some of them are also relatively inert. What I mean is that they don't have side effects. So if they have little side effects. So if someone has such a situation, he should complain to the doctor. And the one that gives problem most of the time is erectile dysfunction. And patient will not like to discuss it with the doctor, but if somebody has such a situation, you need to discuss with the doctor, and the drug can be changed. Well done for the impactful presentation. Okay, this one. How can we reduce, or what can do to reduce our cholesterol? Number one is lifestyle changes, which include the diet. We consume less the food that contains high levels of cholesterol, and this may be in oil, may be in fat, even the sugar itself, excess consumption, because the sugar we consume will relatively be converted, be stored in the body as cholesterol. But taking more of fruits and vegetables, and then taking cholesterol drugs can also help, and then physical activity. Those are the things that can help in reducing cholesterol level. I would like to begin by congratulating the parents. My question is that is there a way to subsidize or even make post-mortem examination free in order to encourage more people to consent to them? The current situation in Nigeria may be a contributing factor to why many families are reluctant to permit post-mortem examination for their deceased relative. Thank you very much. I don't know the cost presently in UCH, but I think I agree with you. If the cost can be made relatively cheaper for relations, that will be fine, because it's also what the resident doctors need and medical students need for training. So if it's subsidized, I agree that the rate may increase, but I think those two other earlier factors I mentioned, the traditional or cultural factors and religious factors, they are actually a major problem that we have. Yes, cost can help, but I think this we may have to discuss with UCH man. I think the management is here, so it's listening to us. Sir. Thank you very much, sir. Please. The answer is capital no. It is not a good idea to stop. It can even cause harm by starting and stopping. So once you commence it, please see it as part of the tiny meat in your food. I keep on telling my patients that hunger is the greatest disease, but it has a cure. Simple cure is what? Food. And if you eat food, in 8 hours, your body will drive for what? More food. You can't say you have taken one today and maybe next month you take another food. God has structured in a way that we take our food on a regular basis. So see that medication as part of your meal. So it's only when we see it that way, we see that we should take it, because the body is hungry for it. So that because the vessels are not relaxing the way they are, so need something to relax it. So the way we use food to relax our, our hunger. So if we do that, even the food we eat, they're all, because many people see drugs as something that we should not take. I'm not praying that anybody should be on drugs, but for whatever reason, you need to take it. Please take your medication. I tell my patients, maybe in 1912, even before my father was born, for somebody to come from Ogbomoso to Ibadan, maybe he has to do that by bicycle or on foot. Is that not correct? Will somebody want to walk to Ogbomoso today when technology has improved it? Nobody tries to do that. Why do we rationalize when it comes to medication? Do you understand what I'm saying? If you can enter an aeroplane to go to America, you don't want to enter ship. In those days, people were spending 2 weeks, 3 weeks, but science has shortened it. Why do we, when it comes to drugs, why do we need to rationalize it? It's the same science that developed the drugs. It's the same science that developed the car, the bicycle, the motorcycle, all the improvement we have. But I'm sure that science is still improving. I mean, if we have a drug that if you take once, BP goes, everybody will be happy. And that's where science is moving. So I would say that if you have medication, keep on your medication, except your physician who knows what he's doing, say you should stop it. Now, please, having electric shock at the chest for a few seconds. I think I answered, it's similar to the question I answered before. The electric shock may be an arrhythmia, abnormal heart beating. So please, need to see a doctor so that they can do proper tests to find out the cause. Is it necessary to take food before taking hypertensive drugs? It's not compulsory. Is there any connection between herbs and modern day medicine to maintain hypertension? Thank you. Yes, there may be herbs that have, even the drug we have, I'm sure the biochemists will tell us that those things were developed from herbs. That's where they came from. But the only problem is quantifying what the individual requires. If our herbs can be quantified, this is the milligram, this is the number of times you are taking it. It must have been tested in the lab and say, this is the maximum dose you can take. If you take beyond that, there's a problem. So that's why ours is different. So if we can modernize our medication such that people will take it and not have problem with it. Because some people take and have overdose and come down with kidney failure. That is the problem. And the other thing we found also is that the so-called herbs, people use diabetic drug and put inside the herbs. Do you understand what I'm saying? They take hypertension drug, drop inside their herbs, and give people to drink. They come to our clinic and see what we are doing and know the medication. They do. We had a patient, a young boy, was on the ward. He was having hypoglycemia. We were wondering what was going on. It was later we discovered that under the bed, there was concoction there. They were taking our own, they were also taking that. And then, when we investigated, it was somebody who gave them, and even in the drug, all the diabetes drugs were there. So that's the problem. Thank you very much. Please discuss the impact of poor and inadequate sleep as well as stimulants like cola nut and sex enhancers. Thank you very much. Inadequate sleep is a stressful situation. So stress is on its own is a cardiovascular stimulant. So it's not good. So poor sleep is related to cardiovascular disease. So that's where I will answer that. So we require adequate sleep for good cardiovascular health. Now, stimulants, things that cardiac stimulants are also not good. And even the one they call, that's one medication. A patient was referred to us from Ife. The young man has been running ventricular tachycardia for 2 weeks. They had to send the boy to us. So he took one of these energy drinks. We have had 2 cases, one from Abeokuta and one from Ife. So those things can stimulate the heart, especially if there are already existing cardiovascular condition. But for normal heart, I would say that there's much contribution there. But sex enhancers, energy drinks, and so on, they can cause harm, especially in people who already have underlying cardiovascular disease.
Thank you so very much, sir. Please, another round of applause. I don't think we've ever had any presentation where there are still these so many questions. There are still some that were unanswered actually online. But we apologize because of our time. we need to quickly round up. Right now, I want to call on the Deputy Registrar and Secretary to the college for his announcements and some remarks. A round of applause, please, as it comes up.
Together. Thank you very much. Once again, I would like us to give the presenter a round of applause. You know, today's presentation is a chart buster. At the point in time, we had 84 participants on Zoom, aside YouTube. And as I stood up, we still had about 69 participants on Zoom. So that's very impressive. You know, our university anthem, there's a phrase that, for a mind that knows, also for the college anthem, it says, training, bringing up to date, knowledge for all. So this program is, you know, it's advancing the vision of the university and of the college also. Excuse me. So please, because of that, I want to appeal to members of staff. Registration is from 8:30 to 8:45, I believe. Registration is from 8 to 8:45. And this program is to start at 8:45. So henceforth, those who register and who are not here after the national anthem will have their names struck off, and they will not qualify to receive the certificates. This training is not all about certificates. It's about building our capacities. So we don't want you to just to come and attend because you want certificate. No. Build your capacity. Come and get the knowledge you need for yourself and for others. I believe we've all picked one thing or the other. At least for me, I've learned something about data cleaning. The last one, we learned about how to manage your desktop, among others. We were online and we joined. You know, so please, come here and improve yourself. You know, for those who read the Bible, there's a place that's saying, faith cometh by hearing and continuous hearing. So, and this place provides the platform for that. I also learned something that the chairman, the presenter said. He said menopause. Menopause is when women begin to experience what men have been experiencing. Well, that's on a lighter note. So, and please also, this is appeal to us. So let's ensure that all sudden death cases are investigated. All right? So you have been informed so that you can inform others. All right? So our certificates are ready for those whose name were mentioned in December when we had the end of the year celebration. So please see the assistant registrar in the office of secretary to the college so you can pick your certificates. Because of time, we'll not be able to do that today. And also lastly, or before the last one, penultimate, you know, let's be doers. For those of us who read Bible, fortunately, this is time for fasting, both for Christians and for Muslims. You know, for those who read the Bible, James chapter 1, verse 22, he says, but be ye doers, and not just hearers. He says, those who are just hearers, they deceive themselves. So all that we learn, go and put them to, and lastly, I want to appreciate once again our deans. Let me mention specifically, or especially the dean of the Mama Dean. She's always here. And I believe there must be a very good reason for her to have come late. Okay, exams are ongoing. You know, she's always here, in fact, ahead of many of us. And I also want to appreciate the Dean of the Faculty of Dentistry, our Director of EAMRAT, and the representative of the CMD, who is also here in his own capacity. So we appreciate you, and we recognize you, and we hope to see more from We hope to see more attendance from the hospital. We send this notice to them from our staff there. So it's a mutually beneficial platform. So please, let's see more of our people from UCH. So on this note, I want to say thank you to all of us. Thank you for coming. The Lord will continue to bless us all. So we've had the Provost's closing remarks. I will hand over to the anchor so that he can lead us to the next thing. Thank you.
Please, a round of applause for our secretary to the college. I'm sure you'll bear me witness that it's been a fulfilling time, a rewarding time. I want to appreciate our guest lecturer once again, Professor Ogah. Congratulations once again, sir. On this note, we have come to the end of this program, but just a quick one. The department, the unit from which Professor Ogah has come, they have a provision for us. Everyone is, we have the opportunity to measure our blood pressure. So it's set up outside where the registration took place. So once we leave here, after the national anthem and the different anthems, let's go out there. There are people that are already stationed there to measure our blood pressure. Shall we stand up as we have national, in reverse order, I guess. In reverse order. Stand up as we Thank you very much, everyone. Let's go out, but let those on the high table gather together for a group photograph, please. Group photograph. Please.
I don't know when I'm coming back. I'll be gone for a little while, but I will keep myself for me and you. I'll be back for you. I don't know what the future brings, but I want you to be with me. I could hope and pray to make you wait for me, 'cause I'll come